Good afternoon, everyone, and welcome to our webinar series, Energy Talks. We are very pleased to have Dr. Banafcheh Hejazi with us this afternoon. I would encourage you to please feel free to type in your questions, and I will certainly read them and relate them to Dr. Hejazi as we move along. Dr. Hejazi, in a way of introduction, is a family physician. She's a professor in the family medicine residency program at McGill University and a documentary filmmaker. She has devoted much of her career to helping those struggling with mental illness and has a particular expertise in adolescent medicine. Dr. Hejazi is also the producer of a documentary titled Les médecins pleurent aussi, which translated means doctors also cry, which shines a spotlight on physicians suffering from depression. And the reason this documentary is so important, not only has it been broadcast on CBC, which is our national network, but it is a mandatory part of the curriculum for first-year med students across Quebec. And of course, among her many other achievements, and there are many, Dr. Hejazi is the recipient of the prestigious Diamond Jubilee Medal, recognizing her 15 years of volunteer service in the fight against domestic violence. Good afternoon, Dr. Hejazi. How are you?
Good afternoon. Thank you so much for having me today.
Thank you for joining us. Dr. Hejazi, let's talk a little bit about how this level of quarantine and social distancing is affecting our physical and mental health and well-being. Maybe you can talk a little bit about that as we begin.
Yes, so we are really going through historical time, and it's very important to have all the necessary tools to stay strong. The pandemic is having a major social, psychological, and physical impact on the whole population. So we see increasing of unemployment, poverty, family separations, family violence, uncontrollable use of social media, gambling online, social isolation, other changes. And these are all major risk factors of stress, fear, anxiety, what we call post-trauma stress, depression, and self-harm. So when we talk about anxiety, usually it's driven by three main situations, by unpredictable events, uncontrollable events, and also the level of importance of the situation to you. The COVID-19 unfortunately has all these three elements. It is very hard right now to predict. Unfortunately, I'm staying positive, but we have poor information about it, little we know, and the high importance is that it can cause death. So I easily can say that right now, I will name it. We are going through a world war where the enemy is a little invisible virus, and it makes it scarier because we don't know what to do about it. So right now, the healthcare providers, police officers, firefighters, educators, all the people in the first line working at the grocery, that is also important to talk about them, because when I go, I see how they are brave to be there. So all the essential services, they are the soldiers and the heroes of that story. And like I said, we know little about it. There are so many research. Every day they talk about medications. There's so much controversy. And the vaccine is not going to come tomorrow. It's going to take a long time. So the few things I notice is right now when I have a patient who has fever, the first question is, Dr. Hejazi, do I have COVID-19? Am I going to die? When a person coughs in public, people start running away if that person has a gun and is going to shoot them. Other things I also see, divorced couples. I mean, when you have kids, the kid is going to stay with who? Usually if it's 1 week and then the other week, now there are fight about it. So it's a lot of stress. And another very sad story, I have a few patients whose parents are old and are dying, and they are not allowed to go see the dying parent. This is really sad because you want to spend time and be able to say goodbye to your parents. So this has a big impact on mental health. Also, I have the honor of working for the last 20 years with the Shields of Athena, which is a center for family violence. And recently they have been giving the numbers of increasing of family violence, child abuse, and this is internationally. So also please, if there is something going on, you have to call 911 if you feel that this is happening. Physical health, well, physical health too, of course, is affected by the COVID-19, and mainly it's the weight gain because we're going to eat our emotion and we're going to be less active because now the fitness centers are closed, the swimming pools are closed, all the sports facilities are closed. So this is not helping. And it's been a few years that obesity has been recognized as a chronic disease. And we know that it can cause over 200 other diseases, including diabetes, hypertension, heart disease, arthrosis, sleeping apnea, and also depression. So there is a strong link between physical and psychological problems, because anxiety and depression is going to increase the appetite and it could make you gain weight. And then gaining weight is going to make you more depressed. So this is a vicious circle. Also, what we notice is that there is an increased take of alcohol, cigarette, and other drugs. I mean, I know Monsieur Legault said drink wine, but we have to be reasonable too. It's good you to have a little glass of wine, but we know that having too much wine, cigarette, or other drugs, it's been proven to really decrease the immunity. So you put your body at a higher risk of getting the COVID-19. And I say that as a joke to my family and to my patients. I don't want you to die from COVID-19, but I also don't want you to die from alcohol or drug overdose or heart attack. So we really have to be careful, because right now COVID-19 has immediate, but also unfortunately a long-term effect on our health.
Yeah, that was my next question, Dr. Hejazi. When we talk about long-term, or we talk about PTSD and any kind of, trauma that might occur after the fact, some people are doing really well, in as much as they can under the circumstances, but what happens a month or 2 months from now when, reality sinks in? Is there such a thing as PTSD in this situation?
Is there any what, sorry?
Any post-traumatic stress from this event? I mean, right now we may be doing well, or we think we're doing well, but once we go back out in the world, is there, could this occur?
Definitely. Like I said, for me, this is a world war. I mean, I call my friends, my family, or anybody we know around the world, and we are all going through the same problem. And definitely, I really compared what is going on to the stress post-trauma of a war. Definitely, yes. So this is, the government, the healthcare providers, this is something we have to take care long-term, because it's not just to put the water on the fire right now. People will have effect on that. There's a lot of social isolation, all the things that I told you earlier. So these are things that is sometimes going to take long-term to repair for some patients. Yes.
Okay, interesting. Dr. Hejazi, apart from what the experts are telling us, what can we do to further protect our bodies and our minds? And one of the questions we have here, which kind of segues into this question, is when children go back to school, when government says it's okay to open those schools, what about daycares and young children, and the fact that kids are always keeping their hands in their mouths, and touching their faces, etc. I mean, what can we further do to protect ourselves when we're out there?
It's going to be hard for the kids. I'm going to be honest with you. I said I have a 6-year-old daughter. She really doesn't understand what's the situation right now. She doesn't understand social distancing. When we went to visit my parents and we were really far in the garden just saying hi, she wanted to go hug them. So for sure, when the kids are going to go back to school, when they're going to go to daycare, this is nothing we can do about it. It's going to stress more the kid, and not understanding why they cannot hug each other, because this is a part of childhood. So the positive thing is this is something that doesn't affect mainly children. But at the same time, we know that they can be carriers of the virus and bring it home. So right now, I understand the fear. I mean, Legault said last week, I think, that they might reopen in May the schools, and everybody got scared because, yes, it's true, the kids can go and bring it back home. So if it reopens for these, the kindergarten and the kids in primary school, even high school, honestly, teenagers, I mean, can you tell them what to do? The social distancing is not going to be something that we can success with children and teenagers,
So,
in my opinion.
so then how do we protect ourselves? Or what can we do at the very least as adults? You know, once things, you know, go back to semi-normal or new normal, whatever the case may be, what can we do to further protect our minds and our bodies?
So for the two things, I mean, the guideline this weekend is going to come for some things about the mask, because, you know, the thing is, every day we are learning something new. Right now, what we know physically, what we can do is washing our hands as much as we can, having that social distancing of 2 meters. The mask, you know, they say it's better to wear it when you go in a public place. It's more to protect the others than you getting the virus. This is what we know for now, okay? But I think that no matter what the guideline, because what we're going to see for the next few weeks and months is that we're going to get guidelines, you know, so we have to follow what's going to be said, because eventually I think that in September, kids are going to go back to school. So right now, I think this is the unknown period. This is the unknown zone. And I think the key for me right now, honestly, to stay healthy mentally and physically, beside washing your hands and keeping that distance, is what we call resilience, meaning that we know we have to go find in ourselves the ability to cope with difficulties. So resilience, we know what it is. We experienced it. We all have a memory of that. And even if we look at the history of humans, humans have been exposed to very stressful situation. I mean, over 100 years ago, it was the Spanish flu, then the First World War, just as examples. So we hear the horrible stories, but we also hear the beautiful stories, especially for the Jewish community, and how some of them, they made it through despite the horrors because of the high resilience. So what is resilience is the capacity for us to adapt ourselves and cope with unfavorable situations. Resilience is like a muscle. So the more you work it, the stronger it gets. And I think that it's important to understand is it's not about how we endure, but how we recharge. And I know that some of the groups are more vulnerable right now, the healthcare workers, and also the people who have a pre-existing mental issues. So resilience will help no matter what to stay strong for that period of time. There are 5 skills for resilience, and I think it's important to know them. It's the self-awareness and being connected to others, to be flexible and letting go physically and mentally, positive emotions, being able to manage strong feelings, and also being able to make realistic plans and take action. I will come back later about how to make those plans. There are some exercises about how to build a strong resilience. So you can start just every day by taking deep breathing. It's been really scientifically proven to deliver more oxygen to the brain. It calms the body and reduces stress. Also having the visualization and imagine what you can do and how you can visualize a positive outcome. It also prepares you to build confidence and decreases the stress. Having also a positive self-talk, that's not easy. We're gonna talk later about the tips of how we can have these positive thoughts. And also having a goal setting daily, meaning what you have to do is you can, as an example, take a piece of paper and write my self-care and resilience plan. So you will write on one side the goals, and on the other side, how you want to accomplish them. The goals, they have to be specific, measurable, achievable, relevant, and in a time bound. So it has to be very simple. Like today, I will talk to 3 people. Today, I will eat healthier. Today, I will exercise. So these are, it has to be short term plan. It's not something to plan in 6 months, because right now, this is what we're going through, and it's important to have these plans to be able to go healthy through that. So other tips I would say about reaching that resilience is not to really read just everything or listen or see everything that is being said about COVID-19. It's very important that you go on the right resources. So I can name some: the CDC, the Quebec CA, Santé Canada. These are reliable resources you can use to be able to have the right information. It is important to stay informed, but I feel that some patients or even people around me, they go 20 times every day to know what's going on about COVID-19. Don't do that. Personally, what I do, I go once in the morning, then once in the evening, and that's enough to get information. And the rest, you should spend time doing other things, like go watch a movie, go read about something else. But don't talk or don't think about the COVID-19, because that's going to drive you crazy. Also, to be able a little bit more to be in control, because having more control, diminish anxiety, is to have a plan. So what is that plan is, what am I going to do if I get sick or a member of my family gets sick? It's really important to have this plan, meaning you have to know and discuss it with your family. If ever this thing happens, what you're going to do. So that is important. Also, keep your routine. A lot of my patients, they start now eating late, sleeping late, and then waking up different hours. And that is not a good routine. I really, as much as possible, I know it's not easy, but try to have, wake up at the same hour, sleep at the same hour, don't sleep too late. Also, what is important, if you have time, is to meditate, take a deep breath and meditate. And also, I have to say it, to keep a good hygiene. Hygiene is sleeping well. Why not take a nap? How long has it been that we don't take a nap in this crazy world where we all work? Now we're home. We know napping is very good and very healthy for the mind. Take a nap and enjoy it. Also, eating healthy. We were talking about gaining weight. This is an important issue. So it's a big challenge. I know I have a lot of consultations about people gaining right now 10 to 20 pounds, and it's not easy. So again, I have to say, this is something really to take care about, especially people who have diabetes, hypertension, cardiovascular disease is important. So the first thing to remember is what is important is to follow the Canadian guideline, which really emphasizes on the Mediterranean diet, so less sugar and more fibers. And when we also go open the fridge, to understand this is our emotions talking. If you had a good meal, there is no reason why half an hour later you go and you want to eat again. So this is something that you have to be aware of. And of course, for some people, it's going to be hard. They're not going to be able to control that. So I think that this is also the time to consult. We know that there are some good medications right now for the last few years in Canada for controlling the appetite, controlling obesity. Doctors like me are doing virtual consultations. There are nutritionists who are doing that. There are amazing apps right now. Technology can be used in a smart way. You can go check healthy diets. And like I said, if the worst is really to consult a nutritionist or a doctor, because we are reachable. Even if it's not physically, this is something that you can consult to the clinics by phone or by internet. I also would like to say that social distancing doesn't mean social isolation. You have to keep your social life. It is very, very important to stay connected, and always try to, personally what I do, I try to call, I try to email, I try to send jokes to my friends, to my family, and really to focus on the positive things. If you have kids at home, it's very important to show them positive things. Kids, they feel your emotions. So if you have anxiety, they will get anxious. So it's important to reassure them. And if they hear about COVID-19, to tell them that scientists are working on it, that there is hope, that it's going to come over. So kids are watching us. It's really, really important to do that.
Dr. Hejazi, if I just may interrupt you, one of the questions, because we're having this conversation, one of our listeners has asked, you know, this is a stressful time, and of course everyone is allowed to feel exactly as they do, but in keeping with what you were just saying, the question is, but while we're dealing with our own stress, some people project their own fears onto us, which adds to that feeling of stress. Do you have any tips on managing that? I mean, you just alluded to that when you talked about children and being positive and so on, but there are some people who are just, you know, negative, if you will. You know, how do you maintain your positivity?
Like I said, it's really important to understand that to understand where those negative thoughts they come from. If it's fear, then like I said, we all right now have fear. Of course, even me, I know that right now I'm doing virtual medicine, but eventually I will have to go back to the clinic and I will have to see my patients. Who's going to be a carrier, who's not going to be a carrier, I don't know. I will just do my best. So when you have negative thoughts, if it's controllable, if you can be positive, have positive thoughts, that's great. But if not, I think really you have to consult. And like I said, psychologists, doctors like me, we are reachable. And it's very important. There are a lot of numbers, there are a lot of sites on internet that if you feel that negativity is 24 hours with you, then you cannot help yourself. I understand we're not all, and this is not just about COVID-19, you know, this is things that some people, they just don't have the capacity to have that resilience, no matter how many tips I can say that you can try to do at home. And unfortunately, if it's very, very severe, then maybe the doctor will have to give some medications for sleeping, for anxiety, because this is not manageable for the patient.
Excellent. Which leads us to our next question. As a physician, how has this pandemic affected you, both personally and professionally? What's going on in your practice? Are you treating patients virtually, and if so, how does that work?
Yeah, so I've been treating my patients virtually. I would say now it's close to 1 month. I've been a doctor over 22 years, and I never thought that one day I would see a pandemic, you know, like the last one was the Spanish flu. And I never thought that I would one day have to go through that. So for sure, this is something that has affected me. And I'm going to be honest, the first 2 weeks, I was having anxiety, and that was not helping. So I had to sit down and remember that resilience is very important. In my case, as a child, I immigrated from Middle East one time to France because there was a revolution, and then we had to leave. And then in France again, we had to move to Canada because that was not the place my parents wanted to be. So all these changes were not easy for me. I went through many schools. I had no friends. I had to restart fresh. It was not easy. Immigration is not something easy. So I had to sit and say, okay, this is another hard time for me, but what can I do? These are the facts. I just do my best. So really, it's something daily. We go day by day. And in the beginning, people were coming to the clinic. We didn't know even what we were supposed to do because there was no guideline. I mean, the more we go right now, the more we know that this is what to do. This is not something to do. Then they started telling us, ask the patient if they've been traveling, if they have symptoms. So sometimes me and my secretary, we felt like we were police officers and telling them, no, you're not allowed to come because you've been traveling. And people were panicking, like, I have my medical appointment and I need to see you. So this was very hard for me. Then I had my kids at home. I have a 6-year-old, I have a 12-year-old. The 6-year-old is first grade. So right now I'm homeschooling, I'm a teacher, and believe me, it's not easy. So this are the things. I had a cleaning lady. I don't have my cleaning lady anymore. So, this is something I'm going through like everybody else. And eventually, this is something we have to manage because what we understand is this is going to be there for quite a while. So as a human being, because that's what I also tell my patients, I'm a doctor, but first of all, what is important to understand is that we are all human beings. We are all going through that. I have my colleagues, some of them are really, really in first line, and they are the real heroes because they are in the hospital. Some of them are treating these patients with COVID-19. So when they come home, they are in the basement. They are not seeing their family. So I know there are worse cases than me. So just trying to follow the tips for the resilience one day at a time.
Excellent. How do you consult virtually? Because we did discuss prior to this webinar, and we know that a lot of your patients are converting to virtual consultations. How does that work? And is that the future of family medicine once this is over?
Virtual medicine, there's been a lot of talk about it for the last few years. We knew that it was going to come because, first of all, there are two major reasons why this is becoming interesting. First of all, the aging of the population, and also the fact that technology is much easier for some consultations. And also we know we're going to have a shortage of healthcare providers worldwide. So we know that technology can increase productivity. So there was actually last year, the Medical Canadian Association did a great study about virtual medicine, and wanted to know if the Canadians were interested. And yes, they are interested. They would love to take their appointments by email. They would love to have consultation. But in Quebec, more specifically, the problem was it was private. So people had to pay. There were a few little companies doing that. There was a dermatology company that started that 2-3 years ago about you would just send the pictures of whatever skin problem you have and then ask the questions. And the doctor was going to even be able to prescribe medication and send it to your pharmacy. So all that was private. So, I wasn't really following that because I'm in the public system. But because of that COVID-19, a month ago, a little bit more than a month ago, the government accepted that we could bill and consult our patients on the phone, which I started, and this is right now what I'm doing full time. I would say it's very interesting. A lot of people are very happy. I'm going to be, I would say if after the COVID-19, we could continue virtual medicine, it definitely have its place. I would say for 30-35% of my practice, if ever RAMQ accepts to let me continue doing that, I wouldn't do it for all my patients, honestly, because there's a lot of consultations you need to examine the patient. So definitely this is not possible. But a 30-35%, let's say you need just to give the result to the patient, or you want to talk about nutrition, you want to talk about mental health, things that you don't need to do a direct exam. So this is very manageable. And I'm going to be honest, this is amazing for environment because people are not going to drive. And now there is a lack of doctors. So I have people coming to visit me from even Sherbrooke City, Quebec City, because they moved and they were not able to find a doctor there. So imagine all that transportation. I have people who work and they're happy because I tell them just take 15, 20 minutes from that hour to that time, we're going to have a consultation. So they don't even have to leave work and they're going to be able to get the results on the phone. I also have very old patients who are very sad because they cannot come back to my clinic physically because they have severe arthrosis, they can't move. And before that, I would have to tell them, well, I'm sorry, you have to ask the CLSC to have another family doctor to have a visit à domicile. But if I can continue to do that with them on a virtual base, because those patients, once they leave me, they go on a list for 1 or 2 years to be able to find another doctor. So if I can continue seeing them virtually, they would be more than happy. So I definitely think there's an amazing place for virtual medicine, but it cannot replace the whole practice of medicine. But I definitely would use it after if we are able to continue this way. Absolutely.
Excellent, excellent. We have a question here, Dr. Hejazi. Someone is asking, I am working from home and getting more sleep, but I feel much more tired. I'm also drinking lots of coffee, and you mentioned alcohol and cigarettes. How bad is it to have 3 to 4 cups of coffee a day?
Mm-hmm. That was also one of my tips. Don't drink too much coffee. Don't drink too much tea. The max, honestly, should be 2. This definitely increases the level of anxiety and affects the sleeping, especially if you have a coffee, I would say after, or tea, after 5 p.m. This definitely affects your sleeping. So have the coffee. I have my 2 cups of coffees every morning, and that's it. I don't drink more coffee after that because I noticed that could affect my sleeping. It's so important to have a nice sleeping pattern, and we know that it keeps you. We know that also for the immunity, it's been really proven that if you have a good sleep, because right now we need our immunity. So sleep well, and really cut on the coffee, the tea, and the alcohol.
Okay. We also have a question related to a conversation we started off talking about, and that's family law and children of divorced families and going back and forth. Do you believe that this endangers children and their respective families, not only physically but emotionally? What are your thoughts on that?
Oh my God, absolutely. It's terrible. And I'm going to be honest, some of the couples right now, what they're trying to do is if they trust each other and they know that they are not in contact with other people, because it has affected so much their children, they still do it, which I don't suggest, but if really this has a bad impact on them, and if they know that the both families are not seeing others, if it's really between them, if it's possible to do it, then do it. But definitely it has a bad impact. I mean, my children are not seeing their grandparents. We're not even talking about parents, and they're not seeing their aunts and uncles and cousins. And it's really having a bad, they're very sad, and they're always at my 6 years old, mainly because she doesn't understand what's COVID-19. I know, when is it gonna go away, mommy, when is it gonna go away? And what can I say? I just try to reassure soon. She has her birthday coming. She's like, am I gonna have a birthday party? So yes, it's gonna affect them, but stay positive and say, you know what? We're not gonna have the birthday party this year, but we're gonna have it next year. And if the parents have decided not to do the 1 week, which is totally respectable, just to tell them that after that, they will spend more time, because then you have to be fair. If the child hasn't seen the other parents for a long time, I think after that, it's really important for these kids to spend enough time with the other parent to be able to compensate a little bit. But yes, it's a stress post-trauma again, absolutely. But we have to stay positive and explain that this is for their health. It's because we don't want mommy, we don't want daddy, we don't want other people to get sick.
Excellent. Let's talk a little bit about the frontline workers, the healthcare, the physicians, the nurses, the hospital workers, and so on. How is this going to affect the practice of medicine once COVID subsides? And you know, the experts are telling us that there may be another wave come winter, etc. How is that going to affect the system?
I'm trying to be positive here. No, it's going to be very, very difficult for us, because all the things I mentioned to you, the mental health, the physical health, it's going to be affected. So we're going to be after all that, or even like you said, there's a second wave coming. So this is going to be heavy, and we have a shortage of staff already. We already know a lot of people in Quebec, for example, but this is, I think, through the whole Canada. But we have a problem of a lack of family doctors already. So imagine after that, there's going to be more mental health issues, physical health issues. So definitely, personally, for my practice as a family doctor in first line, I better stay strong and healthy for them, because I'm going to have more visitations. Definitely. It's going to be a stress post-trauma of war. And this is something we know it's coming, but one day at a time. I mean, this is what it is. This is a period we're going through. It's going to be heavy, but it's going to be difficult. So I really hope the government is going to help us go through that, because it's not going to be easy.
Okay, and one final question, Dr. Hejazi, how would you advise us on transitioning? I mean, it's obviously everyone is going to have a different level of anxiety and stress once, you know, we're allowed out and back to school, back to work, you know, allowed to shop, etc., etc. How would you advise us on making that transition in a way that is respectful to other people, in a way that will give us peace of mind, our families, etc.? What are some of the best ways to transition back to whatever this new normal will look like?
Right now, I'm going to be honest. The thing is, we really have to see what the government is going to say, because we don't know what's going to happen. We know that in May, they want to put back the construction. Then is it going to be the health providers? Then is it going to be the school? So I think this is going slowly, which, to be honest, I'm going to be honest, I feel that we are very blessed right now to be in Canada, and especially the government of Quebec right now. I feel, I mean, nobody's perfect, but they're really trying to do their best to diminish the level of stress of people, and trying to respect. I mean, we saw that when Legault said, oh, maybe in May, we're going to return the kids to school. But then he saw the reaction, and he's like, okay, you know, I think we're not ready for that. So I think, first of all, this is something that we have to follow, depending what because there is right now, so you have the medical things going on, and then you have the politics. And it's not always easy to know what's the best interest. So right now, whatever it is, this is something that we have to go day by day. We cannot think too much ahead. For people who have too much stress, and they're also wondering the famous what if, it's very important to stop it and go daily, because we don't know much about the virus. We don't know what's going on. We had a beginning of hope about some treatments. Right now, we don't know what's going on. What is really important is to really try to keep it healthy physically, mentally. And again, if the level of stress gets out of hand, really, if you feel, because we know that there is a moment that you feel that you are harming yourself or you are harming other people and you are being negative to everybody, and this is affecting your life, your surroundings, really consult. I mean, you have to consult. And as healthcare providers, we are here, psychologists, social workers. Maybe physically it's closed, but we are reachable, it's accessible. We talked about the virtual. Honestly, every day, 70% of my consultations when I call my patients is about mental health. And we really have to help. And I have a questionnaire I go through with them to see how this is affecting them. There are interesting questionnaires on internet about depression, about anxiety. And if you don't know what is going on, you can do the questionnaire, see how much this is affecting you. And if yourself or your surrounding, you feel this is not helping, I guess you really have to consult.
Okay, and we have one final quick question that I'm going to try to get in before our time is up. We have a listener here who's worried about how to get their preschooler back to a daycare routine. Right now, the preschooler is at home and getting lots of wonderful attention from family members, etc. How do you make the transition for someone that young, into a back to a normal routine?
The transition to go back, you mean to the daycare?
Correct.
That's going to be, that's something that the government will tell us how to do that. This is not our job to do that transition. Honestly, first of all, I don't feel this is going to happen before this fall. We saw the reaction of the public right now. Parents are scared. Nobody is willing. Even let's say they say, okay, whoever wants, if it's going to be on a volunteer base, again, I don't think a lot of people will let their children go back. What I hear from colleagues or other people is that maybe what's going to happen is going to be a slow return. Maybe they're going to ask a part of the kids to go half-time, because we know that there's the lunchtime where the kids are trying to interact more. So maybe it's going to be a few hours, 2-3 times a week. I don't feel that when the doors are going to be open for daycare or schools, that it's going to be right away full time. I think what's going to happen, because what I feel that is they have to keep the social distance, this is the biggest challenge, I think, how they're going to do that. To be honest, I'm not a politician, so I really don't know how they have to do that. But I don't feel that they're going to send all the kids all at the same time to school. And maybe it's going to be a few hours, a few days for each kid. But then again, maybe also another thing that is going to happen, we saw that in Europe, some countries like Switzerland or others, after a while, they're like, you know what, we just open the door and we see what's going to happen. But I don't feel this is going to happen in Quebec. I feel that they're going to go very slow, and we shouldn't be seeing that before September. And don't forget, from now till September, there's a long way to go. I hope until then, there's going to be some treatments. There's a lot of study that are being done in Europe, in Canada, in the States. And I really have the hope that we will know more about the virus. And again, the good thing for the kids is they are not at high risk like adults. So this is very positive. I think for the kids, what is really positive right now is what it is. But that transition, to be honest, this is something very political. We will not be able to decide that. This is something that the daycares and the schools are going to tell us probably this September, how they're going to do that transition. So we shouldn't stress about this. Is not our job to do that transition. This is the government role.
Right, but I guess one way is to maybe, to your point, maybe transition them emotionally, and maybe send them back a couple of hours as opposed to an entire day, and maybe make that a little bit easier for them.
Yes. Yeah, if we're talking about the emotions, I think definitely the kid should not go full time. And I think what they're talking about is that, meaning that they would like to send them part time, and it's going to be on a gradual base. It's not going to be sudden. I don't feel this is what's going to happen.
Okay, excellent. Well, Dr. Hejazi, I guess the takeaway from this is to stay positive in light of everything that's going on. Watch what you eat, watch what you drink, try to exercise, take naps if you can, be good to yourself and people around you. And if you need help, there's help out there. It may not be a physical visit to your doctor, but it certainly can be a virtual consultation, and you're not alone. And everybody has varying degrees of tolerance and resilience, and don't think too far ahead in the future. Just take one day at a time and go with the flow, as it were.
Absolutely. And if there is one last thing I would like to add, is something I also give in my conference for the doctors, because mental health of doctor is also very fragile. We are high risk of burnout and suicide, is don't forget your identity. When you're home during this time, it's really important to understand that your identity is not just your job. Doctors, we have this problem. When we want to say who we are, we say we're doctors, but we're not just doctors. We are mothers, we are wives, husbands, friends of someone. And this is the time really to spend time with your family, with your loved ones, and do the hobbies you always wanted to do that you never got the chance to do. And really understand that your identity is not just your job. It's very important to understand that you have other qualities, and maybe it's the best time of reflection to know yourself better.
Outstanding. Dr. Hejazi, thank you so much for taking the time. We know that you're busy and have lots of projects on the go. So thank you very much. We are going to be posting the webinar on our social channels, on our websites. We invite you to please share those with your friends. Dr. Hejazi, thank you so much for taking the time today.
Thank you for inviting me.
Thank you. Bye-bye.
Bye-bye.